Hello, welcome back to Simply Women's Health with CJ. So you're thinking that you would like to have a baby. In today's video, I'm going to talk about some different things that you can do to increase your likelihood of getting pregnant and decreasing your risk for having a baby with a birth defect. First things first, you do want to familiarize yourself with your menstrual cycle in order to figure out when it is that you ovulate. Normal cycles occur every 21 to 45 days, and we typically ovulate 14 days before the onset of your next menstrual cycle. Once you do ovulate, that egg typically gets fertilized within about 12 to 24 hours. Now here's the good news. Sperm can live in your fallopian tubes for up to 5 days prior to ovulation, which will give you a good 6-day window of opportunity to conceive a pregnancy. So what's another way that you can figure out when you ovulate? Monitoring your cervical mucus. 1 to 2 days prior to ovulation, your cervical mucus will become thin and stringy and stretchy. It's a product that's actually called spin barket, and the job of the spin barket is to hold onto sperm. Your reproductive system has one job, and that is to make a baby. That spin barket can help increase your likelihood of becoming pregnant. So if you see that mucus, I highly recommend that you go ahead and have sex that day. So how often should you be having sex? It depends on who you talk to. Some people say every 1 to 2 days, some say every 2 to 3 days. I typically tell my patients, try for every other day or 3 times a week, whatever works best for you and your partner. After you have sex, do not get up and trot to the bathroom. You want to lay down, put a towel up underneath your booty and elevate your hips for 20 to 30 minutes in order to give that slow sperm a chance to get on their merry way to find your fallopian tubes. I do recommend that after you have ovulated and you have had unprotected sex, that you do wait a good 2 weeks before you do a pregnancy test. It's going to take that long for your fertilized egg to get into your uterus, implant, and start creating the hormone that indicates a positive pregnancy test. So when do you get concerned? If you are less than the age of 35 and you have been engaging in unprotected frequent intercourse for more than a year. If you are over the age of 35 and you have been engaging in frequent unprotected intercourse for 6 months. If you have a history of polycystic ovarian syndrome, endometriosis, if you've had pelvic surgery, I do recommend you make an appointment with an OBGYN or a reproductive endocrinologist for further evaluation. So what are some things you can be doing now? Number 1, I recommend that you either take a prenatal vitamin or make sure that your multivitamin has folic acid in it to decrease your risk of having a baby with spina bifida or a neural tube defect. If you are currently smoking, drinking alcohol, or using drugs, those behaviors do increase your risk for having babies with birth defects, so I do recommend you stop those behaviors, ideally before you get pregnant. If you have a long-term health issue such as diabetes, make sure that your blood sugars are under control before you conceive a pregnancy. If you are on medications on a long-term basis, make an appointment with your provider to make sure that those medications are pregnancy-friendly. If you are using an over-the-counter water-based lubricant during intercourse, keep in mind a lot of those are what are called spermicidals. They will actually kill sperm. There is a product out there called Conceive, Preseed, that actually does not kill sperm and can increase your likelihood of getting pregnant. If you have any questions about the content in this video, I would love it if you would drop those in the comments section below. And if you have found this information helpful, please hit the like button. If you're still here, thanks so much for sticking around through the entire video. If you feel as though this information has been helpful to you, or you think you know somebody that might benefit from the information provided in these videos, please feel free to like it, share it, and if you haven't already subscribed, I would love it if you did that. Any and all support that you can provide is so greatly appreciated. As always, these videos were not created as a replacement visit with your healthcare provider, rather as a place for you to come for basic, reliable information that is non-biased and hopefully allow you to figure out what questions to ask your healthcare provider at your next visit to best meet your healthcare needs. Again, I appreciate all of your support. If you want to contact me, my information is at the top of this screen, and I will put it in the comment section of this video. That's all I have for today. This is CJ. I'm at your cervix.